buprenorphine with naloxone. Brand Suboxone. Buprenorphine with naloxone is a partial agonist opioid receptor modulator and an opioid antagonist, DEA Schedule III, for opioid addiction.
Heroin derives its effects from being converted in the brain to morphine, which then binds to and activates the opioid receptors in the brain. The receptors are specialized proteins located on the surfaces of cells. Opioids latch onto the receptors and trigger effects in the cells. There are three types of opioid receptors: mu, delta, and kappa. Opioids that are either used for treatment or misused produce their effect primarily from binding to mu receptors. Activating these receptors can produce analgesic pain-killing effects, euphoria, sedation, dependence, respiratory depression, and more. The euphoric effect, and dependence in particular, may lead to addiction. Heroin is a full opioid agonist, which means that it binds to and fully activates opioid receptors. Other examples of full opioid agonists include methadone, codeine, and morphine. People who take opioids regularly, whether for medical reasons or illicitly, can develop a dependency on it. If they abruptly stop, they may develop uncomfortable withdrawal symptoms. Withdrawal can increase a person's risk of restarting opioids and overdosing, which can be fatal. Treatment with Suboxone can reduce withdrawal symptoms and lower the risk of overdose. The buprenorphine in Suboxone is a partial opioid agonist. As an opioid, it still produces analgesia and euphoria, but as a partial agonist, these effects are felt to a lower extent than with full opioid agonists. Furthermore, the opioid effects of buprenorphine increase with each dose increase until they reach a ceiling at moderate doses where even if the dose is increased, the effects do not. This lowers the risk of buprenorphine being abused and of side effects, making it a vital substitute for heroin or other full opioid agonists to help individuals addicted to opioids as they begin their detoxification.
This life-saving prescription medication has proved to ease opioid withdrawal symptoms in numerous studies. By reducing withdrawal symptoms, Suboxone lowers the chances of relapse in many patients. Although Suboxone is a relatively new discovery, its success in medical trials makes an effective form of evidence-based treatment for addiction. It is important to note that Suboxone is itself an opioid drug, so it should only be taken with a prescription under close medical supervision at an addiction treatment facility.
Have you been prescribed painkillers and now find yourself dependent on this medication? Suboxone treatment may be the right choice for you. Ask your doctor for more information about Suboxone, because opioid addiction is not something you should have to go through alone.
Can you become addicted to Suboxone? The answer is yes. Suboxone is a prescription medication that is used to aid in opioid addiction or alcoholism recovery. Suboxone, which is part naltrexone and part buprenorphine, can reduce opioid and alcohol cravings and offers relief from withdrawal symptoms when used correctly. However, taking Suboxone long-term or misusing the drug is highly likely to end in an addiction or an overdose. Let's take a look at some of the physical and behavioral signs of Suboxone addiction. Have you been on Suboxone for more than 30 days straight? Are you obsessing about finding more Suboxone? Making frequent trips to the doctor's office? Feeling tired during the day? Having trouble sleeping at night? Feeling withdrawal symptoms? Losing interest in your favorite activities? Having problems keeping up with responsibilities? Has using Suboxone created relationship problems? Are you lying and manipulating to manage your drug use or stealing money or drugs? Although you may not feel as though you're addicted to Suboxone, if you notice any of these behaviors, it's important to consider that you may have become dependent on the buprenorphine in the medication. The best way to find out if you're really abusing Suboxone is to talk with a professional about your symptoms.
Suboxone is a medication prescribed to help patients during their recovery from opioid addiction. However, it's basically like fighting fire with fire, and countless people replace opioid addiction with Suboxone addiction. When you decide to quit Suboxone, don't be scared if you experience nausea, vomiting, diarrhea, slurred speech, poor coordination, insomnia, sweating, depression, drowsiness, small pupils, poor memory, or erratic behavior. The withdrawal symptoms can be tough, unless you know how to quit the danger the right way. How? There are a ton of prescription medications that can ease withdrawal symptoms without replacing one addiction for another. These include clonidine, gabapentin, benzodiazepines, topical pain relievers, and non-steroidal anti-inflammatory drugs like Advil or Tylenol. Freeing yourself from the Suboxone prison typically takes about 2 weeks, and if you or someone you know is serious about quitting, it's best to secure a treatment plan from trusted professionals who care.